it's really a lot of working on that interprofessional realm because we are holistic. And then really trying to work with other providers, knowing your limitations, being like, well, that's more of like a PT thing, or that's more of a functional med nutrition thing, or that's more of a, but then having those referral sources, because people then start to trust you.
I'm Sean Hessinger, and this is Small Biz in 15, the show where we bring you small business news and tips to make your small business better. Today, Dr. Alicia Reiser, owner and occupational therapist at A Rise Above Occupational Therapy Services, discusses opening a private practice in occupational therapy. So, Alicia, to begin with, when we say occupational therapy, what is occupational therapy exactly?
So occupational therapy is different than physical therapy. Our organization, AOTA, has defined it. I'll give you the definition from them, and then I'll explain it in more functional kind of words. But it's the therapeutic use of everyday life occupations to support occupational performance and participation in meaningful tasks. So what we really do, where physical therapy is more about range of motion, strength, healing injuries of the body, OT is a little bit more holistic, and we definitely look at who you need to be as a person and what you need to do in order to function. So that's either by restoring what you might have lost after an injury, or it's compensating by using adaptive strategies to kind of get you to be functional with what you need to do. So be it a student, be it a grandparent, be it a worker, we kind of get you back, and we analyze those activities based on different task performances to see, okay, what can't you do? Where are you struggling? And then we try and figure out why. And then we try and give you solutions to fix those kind of functional problems.
If I was to ask, what does an occupational therapist do? Like, could you give me some examples of things you might do? Or
Sure. And it all depends on your setting, right? And who you're treating. So what is a wonderful thing about OT is that we treat the whole lifespan. So we work with children, so that's more pediatrics, but we can also even start in early intervention in newborns. So those OTs are kind of looking at if it was a preterm birth, or if there's sensory issues or feeding issues, OT can definitely help with that. One of the niches for OT is a lactation consultant, just because we're working on the bonding experience with mothers and that sort of thing. But we also then work in nursing homes, and we work in retirement homes and assisted livings and independent livings. And we can look at things like, why are you falling when you're getting dressed? So where PT, again, would look more at like the balance issues or their neuropathy, where they don't have feeling in their legs and that sort of thing. OT will be like, well, what can we give you to make yourself be able to get your socks on or to get into the shower? So more sort of adaptive equipment kinds of things so that you can still function in terms of that. But there's so many things in between that lifespan. There's driver's rehab. There's sometimes we work in the mental health setting, and we really explore, what we can do to improve mood and affect, and strategies that we can use with ADHD or autism spectrum. There's sensory integration kinds of fields that we work in. So again, the wonderful thing about OT is you don't get bored. For sure. Like if you're not happy with where you're at, whether it's a hospital setting or an outpatient setting, then there's always room for you to still use your OT hat, if you will, to kind of do other things.
Well, I'm glad you brought that up, hospital settings versus other settings, because this is something that I know you're really an expert on, which is if you want to start a private occupational therapy practice, how do you do that?
It's difficult. You need a lot of support, and it all depends too, I believe, like in your neighborhood or in your neck of the woods, right? So where I am at, we are surrounded by large network hospitals, so it wasn't that easy. So that's why I had to kind of find a niche practice that the hospitals weren't doing or weren't capitalizing on. So we've kind of really drilled down into what we do. We do concussion rehab and a lot of neurological rehab, so anything brain related. But we really offer a more holistic approach that, unfortunately for the hospitals, they can't offer, because they are very productivity based, and they're very, you have to see this many people, and And unfortunately, it doesn't allow the therapist to have a whole lot of time. And that's what I didn't like. And so that's why I wanted to go out into the private practice realm so that I could really treat the patient how I thought they deserved to be treated.
I'm wondering if you could give some other examples, like maybe of areas of specialty for occupational therapy, because I guess depending on what kind of practice you want to build or what kind of specialty you have, you might. Can you give us maybe just a couple of examples? I know there's a lot. But.
Sure. And I hate to keep comparing us to PT, but PT is known for orthopedic, sports medicine, those kinds of things. OT, there's not a lot of OT private practices out there. One, I think we're afraid to kind of make the leap of faith, but there's definitely areas that we can work on. So there's a lot of pediatric private practices. So working with kids, 3 to 10, that sort of age range. The other OT practices that I know are typically hand therapists who kind of go out on their own, and they either then work with hand surgeons who are affiliated with different network hospitals or that sort of thing. Other, though, up and coming OT niches are mobile based. So they bill as an outpatient facility, but they travel to the person's home. So it's kind of like home health, but they're using, if you're using Medicare, it's their Part B benefits and that sort of thing. So that is a huge up and coming thing. I know there's another local OT who's really pushing for driver rehab. Again, having your own on the road car and being a certified driver rehab specialist. So those are those niches that are kind of already established. But what I mentioned with OT is you're really limited only by your imagination and what you can do. Because like I said, you could be a lactation consultant as an OT. You could, do more mental health kinds of things. And that's what I kind of wound up doing with us. We started as more of concussion based, but with own personal observations in terms of the ADHD and the autism spectrum community, I noticed that kids age out. And then, so what happens to these kids who either weren't diagnosed or who kind of flew under the radar? And so who were struggling with either the transition from middle school to high school or from high school to college, who kind of had the life skills or the living skills, but who didn't really know how to be an adult or how to put that higher level thinking hat on. They were okay in high school when someone was reminding them or they had Schoology or something like that to kind of say, these are your assignments, but they had no idea what to do. And it was like syllabus week and then you're on your own and there was no follow-up or feedback. And then they'd kind of be the finals week, cramming all their work in and that sort of thing, or just struggling being on their own, knowing how to eat and study and that sort of thing. So because ADHD and ASD are brain related, I became ADHD certified. The other therapist that's here is autism spectrum certified. So kind of work with that middle of the road population, those teens that either weren't diagnosed or who, parents are kind of like, I think there's something going on. Can you kind of help? And then, so because I'm brain based, we've developed, a program where we can work with those kiddos too, because they have executive functioning issues. Concussions have executive functioning issues. A lot of them have visual sensory issues. And because of the concussion, a lot of those patients have visual issues. So I've kind of pulled from a couple different brain-based treatment strategies and kind of applied that across the board.
Hey, I want to talk about branding because branding can be a huge part of standing out with your private occupational practice. So I want to ask you about, of all things, the way you chose the name for your practice. How did you do that? How did you come up with that name?
I have this uncanny ability to come up with plays on words. And so I wanted to kind of, again, indicate that we were something different from what people have experienced before. And so I was trying to figure out what kind of name that would be. And then I remember where I was standing next to my computer desk and all of a sudden it hit me. So again, my name is Alicia Reiser. And so I was like, well, what about A for Alicia and then Rise for Reiser? And then so people are rising above their, their challenges, or we provide a service that's a rise above anything else that you've had before. So I don't want to think that it was like egotistical, but I just knew that what was being done out there needed to be kind of bumped up a level. And so I kind of figured out that the name indicated that. And so we get, people are like, rising up, I don't know what people, rise above and beyond. And like we're not perfect at our branding because patients will tell, their other medical providers where they're at and they kind of mix it up a little bit. But I think it's catching on.
I'm sure this is what terrifies a lot of people in any therapy practice when they're going out on their own. How do you get patients for your private occupational practice? I mean, yes, I'm sure you've dealt with patients who might follow you, might be interested in, might want to know what you're doing. But I mean, that's not in and of itself, can't build a business. So how do you do that? How do you get patients? How do you attract them? How do you get patients into a private therapy practice? What's been your experience, successes, failures, that kind of thing?
This is something that I kind of was very, very lucky because when I left the one network, they kind of knew what my idea was and what they wanted to see, but they also knew that based on politicking or finances that wasn't going to be able to be done at their location. So I had developed a good rapport with those providers, and they will still refer to me, even though it's strongly discouraged to refer out of network. So I think just kind of then the proof is in the pudding too, based on, the results that we give. Typically, they give us the more challenging patients, the ones that have not just the concussion, but might have a pre-existing ADHD diagnosis, or who have more of a mood disorder kind of thing in terms of like depression or anxiety, because they know that we're going to incorporate that. We're not just going to look at eyeballs. We're not just going to look at memory. We're going to look at them as a whole person and integrate a whole lot of different interventions. So I've been very lucky in terms of, staying in contact with those providers. Because of where I went to get my clinical doctorate, my mentor is nationally and world renowned. And so I tend to name drop a little bit that I studied under him. And then a lot of times then other optometrists will say, well, you studied under him, so you kind of have to know what you're doing. So there's a fine line here too, that we have to stay within our scope when we're treating some of the vision. But we do work very, very closely with optometry, behavioral optometrists, neuro optometrists, developmental optometrists. But I had to work at that. And I, again, had to kind of prove and let them trust me and know that I would only do things that they allowed me to do. We'd have a working relationship where they would see my reports and that sort of thing. So it's really a lot of working on that interprofessional realm, because we are holistic. And then really trying to work with other providers, knowing your limitations, being like, well, that's more of like a PT thing, or that's more of a functional med nutrition thing, or that's more of but then having those referral sources, because people then start to trust you, as the expert, at least on the OT end. And then you can be like, and I trust these people for PT, and I trust these people for, counseling and psychology, or you want to try something a little more holistic, like Reiki or yoga or, those kinds of things. Well, then here are the people that, we've had success with then too. And then you kind of just build your network. You surround yourself with people that are like-minded, and then you build it and they will come.
Well, that's it for another episode of Small Biz in 15. Thanks again to Dr. Alicia Reiser. Please like and subscribe if you enjoyed the show, and please leave a comment and let us know what topics you'd like to see covered in future programs. For more small business news and tips, join us at smallbiztrends.com.